While we're on the topic of targets, Sohail, tell us what you think in terms of an understanding of the mechanism of action and how important is that in choosing a therapy?
So let me just start by saying that we don't really fully understand the mechanism of action of the drugs we have for MS. We have some understanding, but not complete understanding to guide us in choosing therapy at this point in time. But when I think about mechanisms, I think of the drugs in four categories. Those who are immunomodulatory, meaning they don't kill cells, but they change their profile and immune profile and inflammatory profile. I think of the immunosuppressive drugs that deplete cells, T cells, B cells, or both. And I think of drugs that interfere with trafficking and migration into the nervous system. And finally, those that are potentially neuroprotective, although we don't really have solid evidence for that with the existing drugs. So in terms of choosing therapy, I think understanding the MOA has certain applications at the present time, practical application in the clinic. The best example would be in the case of NMO, where we think that the antibody is involved in the pathogenesis. And because of that, it would make perfect sense to use a B-cell depleting agent rather than, a pan-depleting agent. So that's one example where I think mechanism of action can help you choose therapy for a particular condition. However, I think understanding the MOA have more implications on safety, particularly if we think of biomarkers that can predict complications of treatment. Perfect example would be the case of natalizumab and PML, where we don't treat patients who are JC virus positive. Another situation would be pregnancy. Understanding the mechanism of action will help you decide, what would be the safest drug during pregnancy. And we have data on a fair number of drugs being safe or unsafe during pregnancy. And finally, I think mechanism of action is important in choosing drugs based on comorbidities that patients might have. Just as an example, if somebody has cardiac disease, you want to avoid drugs that can affect heart rate or heart function. Thyroid disease, you want to avoid drugs that can result in autoimmune thyroiditis. So those comorbidities and understanding the mechanism of action of the drug and its side effects can help you select the appropriate treatment for the right patients.
Other thoughts on mechanism of action?
I couldn't agree more.
I particularly like natalizumab in people who have concomitant inflammatory bowel disease, for example. On the other hand, I might avoid fingolimod in diabetics because they're more likely to get macular edema, and hypertension occurs with a couple of the agents and such. So I think that it's not the first consideration, but I think MO fits in there, and especially with the comorbidities. And the other is pregnancy, which is a much longer conversation, but which we take up with every patient. It's almost all of them are in the reproductive years, and the timing and such, which would probably take us another evening's discussion just on pregnancy. Yes, Clyde.
Is the notion of sequencing. So a mechanism of a particular drug that's going to necessarily deplete a population of cells, maybe you have another drug that's going to have an effect on trafficking, and if there are no cells around to affect on the trafficking, you've wasted your time, or just the opposite may be true. So knowing what the drug does, I think, is very important, and knowing where you're going to go after that is key.
Absolutely, and I think it will be more important when we start combining drugs, because ideally, if you're entertaining combination therapy, you want to use drugs that have different mechanisms of action, and that's why understanding mechanisms are important. Although I should say that a fair number of these drugs have overlapping mechanisms of action, but there are differences that could be enough to rationalize combining certain drugs.